Hi, my name is Sarah, and today I'm going to be performing a medication administration for a patient named Tyler. So let me just read to you why he's here. So Tyler is here. He's a 5-year-old boy admitted for gastroenteritis. So he's currently feeling tummy ache, and he's complaining of tummy aches, and he rates the pain scale 5 out of 10 on the FACES scale. So we know that he weighs 38 pounds, which is also 17.3 kilograms, and currently the time is 1 o'clock in the afternoon. So before giving him meds, I want to go assess him, see how he's feeling one more time before I pull out the meds, see if there's any non-pharmacological interventions I could help him with. But it seems that he wants these meds, and he also has orders for meds, so we're going to go grab some meds for him. So first I want to just check and make sure that the order for his medication is matched up with his medication administration record, with his MAR. So I see the doctor, Johnson Beals, has prescribed Tyler Perry, my patient, with 15 milligrams per kilogram, Q 4 to 6 hours as needed for pain scale of 4 to 6 out of 10. That was Tylenol that they prescribed to him. And then I could also check the MAR, which is where the medication would be in. And the MAR also has given me two options, but I will choose the 15 milligrams per kilogram because his pain scale is 5 out of 10. So that is appropriate and safe for this patient. The other one was a pain scale of 1 to 3. So this one would be appropriate for Tyler, and I saw that the last given med was given at 8:10 a.m. and it's currently 1 p.m. So it is also the appropriate time to give my patient this med. So after just checking the accuracy of the MAR with the doctor's orders, I'm going to look through his chart and just see his vital signs trends, see if he has normal respiratory rate, blood pressure, that everything is looking okay. I want to also make sure that he can swallow, so maybe if the speech eval came by, I could look at any notes if he does have any trouble swallowing, and making sure that he is not NPO. And then I will also assess for any allergies that he may have. And also I could also look through his labs, making sure that he doesn't have any contraindications. Maybe he may have abnormal LFTs, but it seems like everything is okay with his patient. So I did my first check on the right medication with the right patient. So Tyler Perry, he's 620, his MRN is 11/22/44. His date of birth is 6/23/2015. Dr. Johnson Beals with his medication record. Tyler Perry, date of birth 6/23/2015. Medication MRN number is 11/22/44, and Dr. Johnson Beals. So making sure, I want to then, before I pull out the med, I want to just make sure that I know what med it is and what, just like a bit more about it. So I looked it up on the drug book guide, and I saw that the medication is also known as acetaminophen, or Tylenol, which is the trade name. The generic name. And I could then also, I saw that the med is an antipyretic as well as an analgesia, and the reason for taking this med is for analgesia because he has a pain scale of 5 out of 10. And then I will then make sure that it is a safe dosage of 15 milligrams per kilogram, making sure that he hasn't gone over the daily dosage maximum of 75, and that's for kids less than 12 years old. I will also keep in mind the side effects that the patient may have, including nausea, rashes, irritability, headaches, and decreased appetite. And some nursing considerations to check is also, I think I mentioned before, but looking through his labs, making sure that his liver functions are normal, because this drug is hepatotoxic. So after that, making sure that everything lines up, we have the right med, we have the right patient, I am going to pull out the medication. So here we're in his Pyxis, we're in the med room right now, and I'm looking at my order. Tyler Perry, date of birth 6/23/2015, 11/22/44 is his MRN number, and then I want to make sure that I find the right Pyxis for it. So this is my check number 2, or no, my check number 1. Here's his, so here we have Tyler Perry, date of birth 6/23/2015, MRN 11/22/44, and the doctor's Dr. Beals Johnson Beals. And I'm gonna pull out the med cart or the Pyxis, and I will double check, make sure that it's the correct one. So they provided us with 160 milligrams over 5 milliliters, but we don't need 160 milligrams. And I will make sure that it's acetaminophen, 160, good. So everything is correct in here. I will put this back. And then I want to do my dosage calculations, which I have already finished. So my dosage calculations is over here. I did the math, and I will be giving and administering 8.1 milliliters. So also, before I touch this, I want to make sure I wash my hands, perform hand hygiene, wear some gloves, because sometimes the medication can be dangerous to your hands. But I will pull out a medication cup, and then I will pour 8.1 milliliters. So I'm going to go to eye level and make sure that I pour just the right amount. Also, I want to make sure that this isn't expired. I want to look for the expiration date, and it's not expired. So after pouring 8.1, I'll put on the cap again, put it back in Tyler Perry's. I put the patient's name, the time, 1 o'clock, his name, Tyler Perry, and my initials. And I could also put his room number, whichever room number we're going to. This is just so that when you carry the meds out of the med room, you don't get confused and you don't end up switching your meds around and giving it to the wrong patient. I want to do my second med check. I want to check that I have the right medication against the MAR. I have acetaminophen, 15 milligrams per kilogram every 4 to 6 hours. And on here, I have acetaminophen, 15 milligrams for Tyler Perry. So I want to check that. And then I labeled it already, so I put my patient's name, I put his date of birth. Oh, I forgot to put date of birth. Date of birth 6/23/2015. And I put the medication and I put the dosage. So I'm going to take this, I'm going to close the Pyxis back, make sure that it's locked again. I'm going to take my doctor's orders, and then I'm going to take my MAR with me. Can I have your, hi, my name is Sarah. Can I have your name, last name, and date of birth? I could just check his wristband, also checking for his MRN number, and I will check that with my doctor's order. Tyler Perry, 6/23/2015, 11/22/44, Dr. Johnson Beals, and I could also check the doctor's order. I'm going to put this down, and I'm going to perform hand hygiene, provide patient privacy, and then I will plan to administer my meds after assessing him. So Tyler, I heard that you're having pain in your belly. It's currently 1 p.m. in the afternoon, and then I will plan to administer the med. I will then try to raise the head of the bed so that he is not at risk for aspiration. And I will open the medication and place it in a cup, but I already put it in a medicine cup in the med room. I will take, okay. So Tyler, here's Tylenol or acetaminophen, which is just gonna help you with that pain, but you have to drink it, okay? And then, all right, are you able to drink it on your own, or do you want me to help you? All right, I'll help you if you want me to. So I want to make sure that he drinks everything in this cup before I leave. Let me know if you have any more pain or if you need anything else, okay? I'm going to document my findings according to the hospital policy. I'm going to reassess him in 15 minutes and see how he's feeling, and if the pain meds have worked. And then I will document that the med was given at this time.